Hi, it's almost 2 weeks now since Hurricane Sandy made landfall. 3 major hospitals here in New York City remain closed, and several nursing homes have had to be evacuated. The infrastructure for our healthcare system has been revealed to be inadequate. How did we get here, and how did this become acceptable? On March 11th of this year, Dr. John LaRosa, the president of SUNY Downstate Hospital, gave a wide-ranging talk to employees. He addressed the issue of hospital infrastructure.
And the state has never provided sufficient capital for the hospital to stay up to date. We are literally at the point in University Hospital where it's questionable whether we can put in a full electronic health record, because the electrical system may not carry it, along with the other things that we have to do. Do you know how much money the state gave SUNY hospitals for the last 2 years in capital? Because it's the only way we can get capital. We can't go out on the bond market and get capital. Zero. Not a dime.
Our hospitals form the backbone of our healthcare system. Let's look at how they fared during Hurricane Sandy. Hurricane Sandy caused portions of Kohler Goldwater Hospital to lose power. When the backup generators failed, patients had to be transferred to different buildings because of the storm. NYU Langone Hospital is in the middle of a massive $3 billion plan to modernize its facilities. Its board of trustees and large group of very wealthy patrons have vast resources, but don't prioritize patient care continuity. City and state health officials allowed NYU Langone to evacuate before Bellevue, even though both hospitals lost power during the hurricane. City and state health officials would not approve the evacuation of Bellevue until all of the patients at NYU Langone found another hospital to go to. These evacuations were compounded by the loss of power at Coney Island Hospital, which was also forced to evacuate. How many patients had to be retransferred because New York Downtown Hospital and the VA Hospital evacuated before Hurricane Sandy made landfall? And if that wasn't enough, health officials did not approve the evacuation of nursing homes until after they suffered damage. Why has the healthcare response been so inconsistent? The director of emergency medicine at Bellevue said, "This is not a tenable situation. There's just too many people. You can't dump this level of patients out on the open market." There's more to Dr. Goldfrank's concerns than he is addressing. He's not just talking about the evacuations of Bellevue or NYU Langone. There have been other hospital closings in New York City that have concentrated inpatient care, such that the evacuation of 1 or 2 hospitals can cascade into a healthcare crisis. There is not enough capacity in New York City to adequately provide emergency medical care in times of a major trauma event or a natural disaster, and at the same time try to make a profit from providing health care in times like these. Health officials never ordered the evacuation of nursing homes in Far Rockaway, an area which sustained major damage from Hurricane Sandy. Now come State Department health officials blaming nursing homes for unacceptable conditions. Maybe the conditions wouldn't have been so bad if there was a hospital nearby to accept the patients most in need. Listen to what was said last year in the time leading up to the closing of Peninsula Hospital.
I am doing due diligence in this case. I spoke with the mayor last night. I did hear back from the deputy mayor, Linda Gibbs, this morning, and she assured me that the mayor did follow through with a phone call to the governor. It did not appear to me yesterday that the governor was aware of the closure of this.
Oh my God!
And let me just say this to you. We know there are closures. We know we've lost 4 hospitals. But I will tell you that the mayor gave pause because he realizes that we have a geographical challenge here in Rockaway. We have one plane an hour, every 4 minutes. I'm sorry, we have a plane a minute every 3 minutes. 400 people flying overhead this peninsula. And we've already had a plane crash. And where will we go with a disaster that might wind up on the shores of the peninsula? We have over 30 nursing homes here in the peninsula. And when they need to go to the hospital, it is an emergency. They're getting their due diligence in their care. If they need emergency service, they won't make it to another hospital.
Who decides which hospitals remain open and which hospitals are closed? And who also are the people who decide when hospitals or nursing homes must be evacuated in times of mass civilian trauma or during a natural disaster? Mayor Bloomberg ordered a partial evacuation of Zone A in Far Rockaway that applied to only people in private homes, not in nursing homes. Did nursing home residents get treated like Rikers Island residents? The infrastructure budget for hospitals like Coney Island and Bellevue is set by Mayor Bloomberg and City Council Speaker Christine Quinn. Priorities for our healthcare system, such as bans on sugary drinks and funding for hospitals, are set by health commissioners. Dr. Shaw is the highest-ranking health official. He answers to Governor Cuomo. Since 2007, 9 hospitals in New York City have been closed. Governor Pataki appointed a commission headed by an investment banker named Stephen Berger to identify hospitals that would be closed in New York State. And Governor Cuomo wants to continue closing hospitals. Let's go back to hear what Dr. LaRosa has to say about Stephen Berger.
Because if you're Mr. Berger and you come from Wall Street, you see 3 hospitals in central Brooklyn within walking distance of one another, you say, well, you can certainly get rid of one of those. You know, it's a funny thing. I'm waiting for the call that I can go to, be asked to chair a commission to go to Wall Street. There are people who make studies of the distribution of medical services and what to do about it. Our current Commissioner of Health is none of them. I've heard nothing from them. The Berger report went to the Commissioner of Health. That's who it was directed to, who has so far made no public comments about it. So when we talk about who's in charge, what's going on, I'm waiting to hear what the Commissioner of Health wants to do with the Berger Commission. If the letters went to him, he's a well-educated, excellent guy with a great appointment. But I have to say, I have to think that somebody else is going to make these decisions, not the Commissioner of Health. We haven't heard a peep from anybody in Albany about what they plan to actually do with this.
People who live in nursing homes and patients who have been admitted into hospitals are very frail. The State Department of Health is charged with the responsibility of ensuring that healthcare facilities are in compliance with regulations over the standards of care being provided to patients. NYU Hospital is in the middle of a major $3 billion upgrade. Very few hospitals have resources like that. In the free market system that we have now, reimbursement rates never rise. Was cost a factor in the reason why so many hospitals and nursing homes were not evacuated? How did we get to a place where our priorities are not in order? With the temporary closing of Bellevue Hospital, Manhattan has lost one crucial Level 1 trauma center. 2 years ago, Manhattan lost another Level 1 trauma center with the closing of St. Vincent's Hospital. St. Vincent's Hospital was closed in 2010 to allow Bill Rudin and Rudin Management Company to build a $1 billion luxury condominium and townhouse complex on the site of the former St. Vincent's Hospital. St. Vincent's was a Catholic hospital run by the Sisters of Charity. It was a major teaching hospital with the noble purpose of serving the uninsured. After some shady deals, St. Vincent's Hospital closed, and New York City lost an important underpinning to public health. St. Vincent's Hospital was never supposed to be closed under the Berger Commission report. However, because of the tone up in Albany, health officials seized on this opportunity to close one more hospital, regardless of the impact on public health. To make that happen, many politicians and business leaders acted in concert to make sure that Bill Rudin's zone-busting development deal would be approved for the site of St. Vincent's. This is where things get tricky. The economics of running a hospital is so dire that North Shore LIJ is going to shuttle patients from an urgent care center to Lenox Hill Hospital. And who would induce North Shore LIJ to take on a very dangerous proposition, which is to transport patients in a medical emergency in an ambulance from the Lower West Side of Manhattan all the way up to the Upper East Side to get to Lenox Hill?
Talk about the Rudins putting money into the O'Toole building, which is going to be some sort of a standalone emergency room. It's my belief that if they put $100 million, $75 million into that building, they could add, there would be beds, they could actually turn it into a small hospital. That is a plausible plan. Instead, there seems to be a move afoot here to have the Rudins get what they want, or get some of what they want, or most of what they want, in return for putting $75 or $100 million into a building on Morton Street to build a new school for the community. There's a trade-off going on here. It's going on behind the scenes. And I wanted the board not to endorse that trade-off and to at least leave open the position, the possibility of the Rudins putting money into the healthcare facility.
This is where we circle back to Hurricane Sandy. A few days after the immediate danger of Hurricane Sandy was over, and we began to realize the effect and devastation on the hospital systems here in New York City caused by the hurricane, Michael Dowling, the North Shore LIJ CEO, issued a statement saying that he thought that there was still excess capacity in the hospital systems here in New York City. Furthermore, he said that he did not think that Hurricane Sandy should be used as a justification to build a replacement hospital in the Lower West Side. The nurses union, NYSNA, reported that in the immediate aftermath of Hurricane Sandy, the only hospital operating below 57th Street in Manhattan was Beth Israel. Look at the unbelievable vital role that hospitals play in our survival. Why do we keep being told to expect less, especially during a natural disaster? Instead of having a truly universal single-payer healthcare system, we let the ruthless free market decide which hospitals get funded. Hospitals can act out of desperation to find sources for funding to meet the needs that they are required to provide to their patients.
Let me make a couple of other points about the Berger Commission report. There are some good points in it, but nobody has caught on to them. One of the good points is that they pointed out for the first time ever in print that I've ever seen that the well-insured patients who live in Brooklyn get shipped across the river, either by themselves or by the hospitals that they go to. Methodist Hospital and Brooklyn Hospital are controlled by New York Presbyterian Hospital. They are part of the New York Presbyterian network. They send no students and no residents for training to either one of those places. They are not part of Columbia Presbyterian's teaching network. When we took over Long Island College Hospital, it will be no surprise to you that what we found that Long Island College Hospital was being used as a feeder hospital for Beth Israel Hospital in New York, in Manhattan. And the reason Long Island College was going bankrupt is because all the patients with the kinds of diseases that require lots of care and therefore are the best reimbursed were leaving to go across the river. Now, there are plenty of people in New York, and I understand who feel that the best care is in these Manhattan hospitals. We're going to work to change that. It's quite honestly very hard to change it when your only university hospital was built in 1965 and the state has never provided sufficient capital for the hospital to stay up to date. We are literally at the point in University Hospital where it's questionable whether we can put in a full electronic health record, because the electrical system may not carry it, along with the other things that we have to do.
We have almost come full circle now. Maria del Carmen Arroyo is the current City Council Chair on Health. Before she became Speaker, Christine Quinn was the City Council Chair on Health. Speaker Quinn is best friends with Emily Giske, who is a lobbyist. She represents Kingsbrook Jewish Medical Center in Brooklyn. While Speaker Quinn was saying that there was no money available to save St. Vincent's, for at least 2 years, Speaker Quinn and the City Council were providing capital financing to Kingsbrook. Because we don't have a truly universal single-payer healthcare system, the rebuilding of our hospital systems here in New York City will be uneven. Last year, activists from Occupy Wall Street staged a demonstration outside St. Vincent's Hospital. The question on many people's minds that night was, why should hospitals that serve the poor be themselves driven into bankruptcy? How do we call this public health?
Every day and every week.
Every day and every week.
Hundreds of people had operations.
Hundreds of people had operations.
Now we have nothing.
Now we have nothing.
Our coalition of 10,000 people
Our coalition of 10,000 people
have attended and spoken at every public meeting
have attended and spoken at every public meeting
that was available to us.
that was available to us.
For 18 months,
For 18 months,
we have requested meetings
we have requested meetings
with the Commissioner of Health,
with the Commissioner of Health,
the Mayor,
the Mayor,
Governor,
the Governor,
Attorney General,
the Attorney General,
City Council members like Quinn,
City Council members like Quinn,
even the Rudins,
even the Rudin,
and North Shore LIJ representatives.
and the North Shore LIJ representatives.
The answer?
The answer?
Silence.
Silence.
No response.
No response.
Nothing.
Nothing.
The issue before us is whether the rebuilding of our hospitals will continue to favor wealthy institutions which primarily cater to the well-insured, or whether we will use this opportunity to examine and fix the unequal distribution of healthcare in New York. As it is, we are on a path that will force us to continue to accept less and less if Michael Dowling and health commissioners have their way. Is this acceptable to you?